Spinal shock. Swelling that occurs at the spinal cord in response to the SCI. Signs and symptoms: decreased blood flow and blood pressure. Complete loss of motor function, spinal reflexes and autonomic function below the level of injury. Occurs immediately after injury in 50% of SCI cases. Can last hours to several weeks. Swelling can affect undamaged nerves, causing paralysis and loss of reflexes and sensation in areas unrelated to the site of injury. Steroids. Autonomic DYSREFLEXIA. Autonomic dysreflexia, hyperreflexia. The abrupt onset of excessively high blood pressure as the result of an overactive autonomic nervous system, ANS. Usually in patients with injuries above T5. Autonomic dysreflexia, hyperreflexia. The abrupt onset of excessively high blood pressure as the result of an overactive autonomic nervous system, ANS. (20 to 40 millimeters of mercury increase due to something that makes the patient uncomfortable below level of injury. Full bladder. Constipation. Tight clothing. Impacted stool. Hangnail. Something they're laying on. Paraplegic, your trunk and your legs are going to have no feeling or minimal feeling, so that sensory information isn't getting back to your brain. However, the body knows that something is happening down there and it sets off your sympathetic nervous system. So this could be something as simple as a full bladder, it could be constipation, it could be tight clothing, it could be the patient laying on something. It has to be something that's irritating the patient below the level of injury. So, let's say that they have a hangnail on there too. It could be something as simple as that. What's going to happen is the blood pressure is going to go sky high. Signs and symptoms: sudden high BP, bradycardia, goosebumps, sweating, flushing, pounding headache, a stuffy nose, no signals can get to the brain to tell it like, oh, I have a full bladder. Instead it goes to the autonomic nervous system and they're like, something's wrong, do something, and it just revs up the autonomic nervous system, so they'll get high blood pressure, but they'll get reflex bradycardia, so their heart rate will actually come down because the pressure is so high. One, take their blood pressure. 2, sit them up so that we can get the blood pressure down. 3, treat immediately by relieving irritant causing the problem. Find the irritant, so whatever is causing the sympathetic nervous system to freak out. Loosen their clothing. You need to find what it is even before we try medication. If you can't figure it out, then you'll go to the healthcare provider and say, I sat them up, I tried all these things, nothing's helping. Then they might give something for the blood pressure, because if not, it can lead to seizure, stroke, and MI or death from having the systolic blood pressure so high. Left untreated can cause
seizure, G,
stroke, death. Emergency care. All patients with trauma to head or unconsciousness should be treated as if they have an SCI. Initial care: immobilize spine, provide adequate airway, prevent further movement that could cause more damage by log rolling and maintaining spinal precautions. Prevent shock, transport patient to hospital. Monitor vital signs, ABGs, other equipment. When stable, provide care for other injury. Log rolling: it is not like 1 or 2 person thing. You want to have someone at the head of the bed, and you want to have at least 2 to 3 other people with you so that you're protecting the spine. Classification of SCI may be classified using Asia Impairment Scale, Pearson, P.969 XXXXX. Complete irreversible damage, loss of sensory, motor, autonomic function below level of injury. Incomplete, varying degrees of sensor, motor, autonomic function below level of injury XXXXX. Central cord syndrome, anterior cord syndrome, Brown-Séquard syndrome, Conus medullaris syndrome,